Hello, it's Dr. Rhonda Johnson, and today is Friday, August 20th, 2021. And today I'm going to be talking about planning for the 2021 to 2022 flu season and why you should consider getting a flu vaccine. I know who wants to think about the flu, right, when we have all of this chaos going on with the COVID pandemic. But the fact is that the flu existed well before the COVID virus came into our lives. You know, that SARS-CoV-2 virus. We at least understand the flu. We know that it's seasonal. We know who's most susceptible to the flu, who's at risk to complications. We've had a flu vaccine for years, and we have one or two anti-flu viral drugs. So let's just talk about the flu for a few minutes. Recall that the flu is a respiratory illness caused by infections with influenza viruses, A or B. Influenza viruses are always changing, and the flu can cause mild to severe illness and at times lead to death. Flu signs and symptoms usually come on suddenly. People who are sick with the flu often feel some or all of these symptoms: fever, or feeling feverish or having chills, cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, fatigue or tiredness. Some people may have vomiting and diarrhea, and that's more common in children than it is adults. And it's important to know that not everyone with flu has a fever, and these symptoms are very similar to COVID. One of the key findings that can differentiate COVID from the flu is the loss of taste or smell, but not everybody with COVID loses their sense of taste or smell. Now, both COVID and flu, seasonal flu, as I said, have very similar symptoms. And in the beginning of these illnesses, it is often impossible to tell them apart, although some people who have the Delta variant will get sicker much faster. Now, here's what I want you to remember. While children under 12 cannot yet get the COVID vaccine, they can get the flu shot. And they can get the flu shot starting at 6 months. So remember that. Now, it takes about 2 weeks for the flu shot to provide protection after you receive it. So parents, it's important that you and your kids get vaccinated for flu this year. Why? Many reasons, but one, it may include that the hospitals are going to be overrun with COVID patients this fall and winter. Based on what we're seeing, unless things turn around, you may not even be able to get in an emergency room, and you certainly might not be able to have a hospital bed. So again, the flu vaccine is an important consideration. Now, to prevent the flu, the same strategies go for COVID as they go for flu. Wear a mask whenever you have company, and if you're visiting crowded indoor spaces, and frequent washing of your hands or sanitizing your hands, and try to avoid touching your eyes, nose, and your mouth. Now, who should get a flu shot? Well, again, they can be given as young as 6 months of age. But always there's some people who can't get a flu shot. So please check with your doctor to make sure you can get a flu shot. If you've had a severe allergic reaction to a previous influenza vaccine or flu shot, you should probably not get a flu shot. And if you're feeling sick at the time you're scheduled to get a flu shot, you should probably wait until you're feeling well. And if you've had COVID infection recently, you want to check with your doctor around the timing of your flu vaccine. So those are just some pointers. Now, new this year is the CDC has made a statement on their website that the flu shot can be given at the same time as the COVID vaccine. So folks, if you are thinking about getting a COVID vaccine and a flu shot, but you only are going to get one and not the other, this is just my opinion, get the COVID vaccine. I think that the COVID-19 illness can be far more deadly than the influenza for most people who are even healthy. So again, that's only if you're going to get one. I would hope that you would consider getting both of these vaccines this year. Now, you can get the COVID vaccine and the flu shot at the same time, but just in different arms, okay? So again, I've given you some background information on the flu shot, the flu, and how it's similar to the COVID infection. It's hard to tell them apart. You can start getting your flu shots now. They're available. Most people get their flu shots sometime in the fall. As always, this information should not ever replace the advice of your personal care physician. My views are my own, and have a blessed day.